Hi, everyone. Imagine this. Dr. Oz, the famous celebrity doctor, he might come back to the healthcare field, but this time he could actually be in charge of Medicare and Medicaid. So President Trump just won his second term, and he said he's going to appoint Dr. Oz, Dr. Oz, as the head of CMS. That's the agency that oversees Medicare and Medicaid. Pretty big news, don't you think? The implications here are massive, especially for people who rely on Medicare or Medicaid. I mean, we're talking about millions of people, right? How this could affect their access to care, the costs, even the whole structure of these programs. It's huge. And honestly, we can't afford to be caught off guard. So let's think back for a second, back to 2020. Remember when Dr. Oz teamed up with George Halvorson, the former CEO of Kaiser Permanente? Yeah, they proposed this whole Medicare Advantage for All system. It was a big idea, and people had a lot to say about it at the time. Now, it's worth thinking about how that might play into what's happening right now. All right, so think about this for a second. Back during the presidential campaign, Medicare for All was this huge topic, right? And then out of nowhere, Dr. Oz and George Halvorson came up with their proposal. They were like, hey, let's scrap employer-provided insurance and the Affordable Care Act's coverage altogether. And instead, they wanted to push everyone who wasn't on Medicaid into Medicare Advantage. I mean, doesn't that sound kind of familiar? Like, remember what Kamala Harris was talking about at the time? The same idea Republicans were all over, criticizing left and right. But here's the thing. This is super important. Just because both plans use the word Medicare doesn't mean they were the same thing. Oz's idea, it was all about private insurance companies running the whole system. Totally different vibe. And honestly, those details make all the difference. All right, let me explain this in a simple way. So both ideas, Dr. Oz's plan and the whole Medicare for All thing, yeah, they use the word Medicare, but they're totally different when you look at the details. Here's the deal. Oz's plan, it's not about the government running Medicare like it does now. Instead, he was all about private insurance companies running the show. Think about it like this. Instead of having traditional Medicare, you'd be picking from private plans. And these plans would have different costs, different benefits, and their own networks of doctors. That's what Medicare Advantage is, plain and simple. Now, here's where it gets interesting. In some ways, his idea sounded a little like what Kamala Harris was pushing back then, but there was a big twist. Oz's version leaned heavily on private insurance companies, not the government. But what's even more fascinating is how much Oz's position has changed over the years. Like, during his Senate run in 2022, he seemed to shift all over the place. At first, he was saying great things about the safety net Obamacare created. Then, he started pushing hard for expanding Medicare Advantage. And by the time he was campaigning, he was out there criticizing the Affordable Care Act. Honestly, it's been a real roller coaster watching his stance evolve. All right, let's take this slow and really think about it. Neither the Trump campaign nor the Harris campaign has been clear about their healthcare plans. And you've got to admit, that kind of secrecy raises a lot of questions. Why not just tell people what they're planning? Why leave everyone guessing? It feels like they're holding back something important, right? This is exactly why we're talking about it now. When there's no clear information, it leaves so much room for speculation. And that's dangerous. Think about it. Whoever ends up running CMS, the Centers for Medicare and Medicaid Services, could have an enormous amount of control over our healthcare system. That's a big deal. Now, if Dr. Oz does get confirmed, we might be able to look at what he's said and done in the past to get some clues. But right now, let's be honest, it's still a guessing game. And when your healthcare, your access to care, and your costs are on the line. Yeah, that's pretty unsettling. So how is Congress reacting to all of this? Well, it's about what you'd expect, a total split. On one side, you've got Democrats like Senator Patty Murray. She's sounding the alarm, saying this nomination could mean trouble for programs like Medicare and Medicaid. She's worried that health care could become more expensive or harder to access. On the other side, you've got Republicans. And of course, they're seeing this as an opportunity. They're thinking this could bring in reforms that align with their goals. But this division, it's turning the whole nomination process into one of the biggest debates happening on Capitol Hill right now. So, yeah, it's complicated, it's emotional, and honestly, it's a lot to take in. All right, here's how it's looking. Republicans, like Senators James Lankford and Mike Braun, are saying they're open to the idea of Dr. Oz running CMS, but they're being cautious. They want to see real leadership from him and have some honest conversations before fully getting on board. That's fair, right? Now, even with their willingness to talk, there's this big concern about Medicare Advantage. One issue that keeps coming up is prior authorization. So what does that mean? It's basically when your insurance company decides if you actually need a treatment or test before you can get it. Think about it. Your doctor says you need an MRI, but then the insurance company says, no, we don't think so. They're adding an extra step. And that's where people are really worried. Are we cutting costs at the expense of patient care? Imagine needing something important, like a scan your doctor recommends, but because of stricter rules, it gets delayed. That's a pretty frustrating and even scary thought. And here's the bigger picture. Medicare Advantage is growing fast. A lot of people are switching to these private plans, thinking they're more affordable or offer better options. So for whoever takes over CMS, this is going to be a tough situation to manage. Balancing the needs of patients, keeping costs under control, and dealing with the rising popularity of private plans. That's a massive challenge. It's a lot to handle. All right, let's take a moment to really think this through, because it's such a big topic. Medicare Advantage. It's growing in popularity, and it's easy to see why. People love the extra options like vision, dental, even gym memberships. It's appealing, right? But here's the other side of the coin. There's real concern about transparency. Are these private insurers being accountable? Are they really putting patients first? Or is it more about the bottom line? And then there's traditional Medicare. It's the foundation of our healthcare system. But with all this focus on Medicare Advantage, there's this worry. It could get left behind. And honestly, that's a big deal. Now add Dr. Oz to the mix. Congress is already uneasy about his stance on healthcare. And on top of that, you've got the issue of drug prices. Remember the Inflation Reduction Act? It was a game changer, allowing Medicare to negotiate drug prices for the first time. Patients were thrilled, but a lot of Republicans, including Dr. Oz, weren't exactly on board. So here's the big question. If Oz ends up running CMS, what happens to that progress? Do they repeal it, weaken it? Or, and this is a long shot, do they actually embrace it? Let's be real though. Big Pharma has a lot of power, and they'll fight tooth and nail to keep drug prices high. Whoever leads CMS will face serious pressure. And putting patients ahead of profits? That's no easy task in today's political climate. Now, Medicare Advantage is something Dr. Oz has talked about a lot in the past. He's even floated the idea of expanding it, not just for seniors, but for everyone. If he's in charge of CMS, it's probably going to be a major focus. But the real question is, how will he handle it? Would he push to privatize Medicare even more? Could traditional Medicare get sidelined? It's hard to say, but these are the things we'll need to watch closely. Let's weigh the pros and cons. The upsides: more choices for patients, extra benefits like dental and vision that traditional Medicare doesn't offer. Private insurers might bring more innovation and flexibility to the table. The downsides: transparency and accountability. Are these private plans really looking out for patients? Prior authorization rules could delay or deny care, even when it's recommended by your doctor. Traditional Medicare might lose funding or get overshadowed, leaving it weaker. It's like walking a tightrope. On one side, you want to innovate and give people more options, but on the other, you have to protect Medicare's foundation and make sure no one gets left behind. And then there's Dr. Oz himself. He's changed his stance on healthcare over the years, which makes it hard to predict exactly what he'll do. That uncertainty? It's why so many people are feeling uneasy right now. At the end of the day, this is about more than just policies. It's about people, their health, their access to care, their lives. And when you add in a new administration, shifting policies, and someone as unpredictable as Dr. Oz, yeah, it's no wonder everyone's paying attention. This is healthcare. It doesn't get more personal than this. And let's not forget Medicaid. It's such a lifeline for low-income families. But you know what? It's always the first thing on the chopping block when budget cuts come up. If those tax cuts happen, Medicaid could be in real trouble. Reduced benefits, stricter rules, and who does that hurt the most? The people who need it the most. That's heartbreaking. So if Dr. Oz ends up leading CMS, what's he going to do? Is he going to go all in on privatizing Medicare Advantage? Or maybe he'll try to strengthen traditional Medicare? Could he focus on fixing drug pricing, or is he just going to push his own agenda? Here's the thing. This isn't just about policies or politics. This is about real people, their healthcare, their lives. And with all the uncertainty around what's next, it's no wonder people are nervous. It's a lot to take in. All right, everyone. As we wrap up this video, I want to leave you with a question. After everything we've discussed, what do you think is most likely to happen with Medicare and Medicaid? What's your prediction? Thank you so much for watching, and I'll see you in the next video. Take care, and goodbye for now.